Hi guys, Batul is from sport rehab student, and in today's video we're gonna go on ACL injury and rehabilitation. So in my presentation for today, I will look for a case study, which is a patient aged 22 years old, female footballer. She has injured her ACL while playing in a match, and according to VAB scale, she got 8 out of 10 pain. She got knee joint swelling, and in today's presentation, we're gonna talk about the pathology of the ACL injury, the clinical presentation of ACL injury, problem after ACL injury, and I will add some video for performing the exercise to my patient and coaching her how to do it, making sure we get a successful rehab plan. And then we will talk a little bit about the outcomes after our treatment, early stage treatment. So ACL is basically the anterior cruciate ligament, is a primary stabilizer for resisting anterior translation of femur on tibia and control hyperextension of the knee. That we can see in the picture on the side. It's also a secondary stabilizer of internal and external rotation, as well as varus and valgus spread. So the mechanism of injury or ACL is injured mainly through a valgus force applied to a flexed laterally rotated knee with a foot planted or hyperextension with medial rotation. This is called dynamic knee valgus. So I have done my subjective and objective assessment for my patient. Mainly I got like motion MOI in landing and twisting injury. I could hear a little bit of popping sound. She complained from a severe pain, and she was unable to wear or continue some activity in all of them. She got a little bit of swelling and instability while turning. I have done and declared all my objective assessment, and I have done active range of motion, passive range of motion with some muscle test, muscle length and extent, and some neurological screen, making sure that I have cleared everything. But the main important thing was she got restricted range of motion, particularly in extension. And from my special tests that I have done, it was a Leishman test, positive anterior door test, and positive Levi sign. So everything else was negative. The patient might need to do an X-ray or an MRI scan diagnosis. And from my positive finding, the patient experienced empty and soft and fill. She got laxity and anterior translation of the tibia from the femur in the injured leg, comparing with the uninjured one. So according to Benjamin et al. 2006 meta-analysis, the specificity and sensitivity of this test is nearly 96 to 92%. So according to the assessment finding, that my patient is most likely to have ACL rupture grade 2, and we requested an MRI scan, making sure our finding is supported with that. So we decided to do a treatment plan for the ACL injury, and we started this after 4 weeks. We just waited for the swelling to subside, and once the swelling subsided, after using cryotherapy, the patient must start a rehab plan. So I have educated my patient about her injury and recommended her doing some exercise at home or some swimming by side. But at the clinic, we decided to do a warm-up session of 5 to 10 minutes before we just start our exercise. I have chosen 3 types of exercise, which is I will perform it and coach it today. The half squat, he raises single leg extension and definitely is followed by some stretches for the muscles around. So isometric concentric and eccentric exercises are allowed at the early stage rehab, preventing any load that can cause more damage for the tissue and delay our rehab plan. So the aim from the exercise at the early stage is we are trying to regain normal joint range for the patient. The patient have reached full extension, reached normal walking gait, and regain quad and hamstring muscle activation, decrease pain and neuromuscular training and balance. What I'm trying to explain here that the knee joint muscles are all related with the hip joint and the ankle joint, and it's very important for us to work about around the muscle around the knee and hip and ankle and do some mobilization for this sweet joint.
So I will ask my patient to do the half squat, and this can be performed by put both hands into the chair, feet and apart from the shoulder, and then I will all what I want at my patient just flex the knee up to 60 degrees and hold it for 10 seconds for 10 repetition. So I will ask my patient to perform the exercise for me, which is the half squat. So all what I need you to put your hand into the table and place your feet apart with your shoulder, and then slightly bend your knee, hip down for 60 degrees, hold it for 10 seconds, and we will repeat that for 10 times.
Hold it for 10 seconds. No, okay, turn towards and sit. Okay, we're going to hold it for 10 seconds. Okay. You're going to count to 10.
1, 2. Okay. And then again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. I will perform for my patient now a single raise extension exercise. Although I need to rub this band around my feet and then slowly extend my feet to 180 degrees. Hold it for 10 seconds and then relax. I will repeat it for 10 times. So you will perform the single leg extension. All what I need you to put the band around your feet and then hold it, extend your feet up to 90 degrees, hold it for 10 seconds, 1, 2, 3, 4, 5, 7, 8, 9, 10, and then relax, and you will repeat this 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, relax. Done. So I will perform for my patient the heel raises. A hand on the chair or a stable place. Then on what I need that my patient slightly bend the knee into flexion, 20 degrees, and then raise the other foot onto the tiptoe. Hold it for 5 seconds and then lower it down. It will repeat for 10 times. So I will ask my patient now to perform the heel raise exercise. All what I need you to put your hand into the chair to balance, and then slightly bend your knee up to 20 degrees. Then raise your other leg. Raise it up. Yeah. On your tiptoe. Hold it for 5 seconds. 1, 2, 3, 4, 5, and then slow down, go down. This is repeated for 10 times. 1, 2, 3, 4, 5, down. 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax.
Done. Cut.
The outcome of my rehab session was beneficial as we got increased range of motion. The pain was decreased and to 6 out of 10 bad scale. We got increase in knee extension and the patient is able to walk and balance more than before. So as a summary, an ACL injury happens when you overstretch or tear the ACL ligament in the knee, and you might need surgery sometimes if this is can cause more damage for the meniscus. And exercise that can be done at home or at a clinic will help the patient to recover faster. And also, we have always to start with the safest exercise and avoid compression or putting weight on the injured knee. So we gradually just increase our loading plan at the later stage. So I have included some references here from or some studies that supported my presentation and my finding. Thanks.